Well, we're here with Dr. Fatunde, a dentist, actually an orthodontist in Garland, Texas. Hi, Dr. Fatunde.
Hi, Dr. Flash.
I happen not to be a doctor, but I will forgive you. I was never. Okay. I was always too lazy and not smart enough to make it into that field. Dr. Fatunde, you know, when it comes to any type of work which we, the patients or the customers, don't understand, and definitely when it comes to dentistry, medical, and orthodontic, we surely don't. So some of us keep thinking that an orthodontic is an orthodontist. It's all the same. And at the same time, I'm very sure that most of you orthodontists or dentists or physical therapists, it doesn't matter what type of doctor, have kind of different philosophies. Can you tell us a little bit about the philosophy of your practice, you know, how you go about, what you do, do you like to see lots of adults or only children which need braces, things like that? And maybe, Dr. Fatunde, maybe you tell us how you become an orthodontist.
Thank you very much. At Sunny Smiles Orthodontics, our mission is to help people achieve the smile that they deserve and that they actually want. So how do we come about doing this? We see children, we see teenagers, we see young adults, and we see much older adults. In all of this, we try to customize treatment to the needs of the patient. And the objective is to help not only to straighten teeth, that's part of what we do, but we actually desire and we do make every effort to give the patient not only a good smile, but a functional bite, a bite that can serve them, whereby we have the teeth in the proper position in all three dimensions, whether it's vertical, whether it's transverse, or whether it's horizontal, so that the upper and lower teeth do come together in the optimized way that allows them to function properly. Why is this important? The function of the teeth, both when they bite and when they don't bite, actually affects not only the alignment of the teeth, it also affects the jaw positions. So in addition to ensuring that the teeth are in the proper and the most optimized position, we also ensure that the jaws, both upper and lower, are in a position that helps the patient maximize and optimize their function.
Because sometimes if those teeth are not correctly aligned, which is one of the main or only function, an orthodontist does in the first place, problems such as headaches and shoulder pain and neck pain could also occur, besides of not looking all that good and maybe not being able to chew all that well, and by doing so again twist and tweak the mouth and strain certain muscles, and in turn get headaches, shoulder pains, and then I think that thing can also be called TMJ. I do not know how to pronounce the full word of that thing, but you, I'm sure, can shed some light on it. Is that true?
Yes, that is the case in a number of patients. The full word is a mouthful. It is temporomandibular joint disorders.
It is a mouthful.
In short, it is called TMJ, and it's basically talking about the joint that brings the upper jaw and the lower together. Around that joint are a number of muscles, a number of blood vessels, a number of nerves that are also affected. Also, that joint also pretty much brings the skull and its contents, that is the cranium, the brain, brings them together with the rest of the lower jaw. So although it's a small joint in the body, it's a very, very important joint. And that is why when you have parafunction or dysfunction of the teeth, that also affects the TMJ. The patients may experience headaches, sometimes the eyes may hurt, anything right in the face really may be affected simply as a result of dysfunction or parafunction of the teeth that translates to the jaws and then to the rest of the cranium.
Right. Well, it is really quite amazing to listen to this type of statement you're making. But at the same time, if you look at it from a part of like whoever created us, let's just call him God, some type of God anyway for everybody. He put lots of important things into this little thing up there, the eyes, the brain, the nose, the ears. So why would we make thinking that our mouth is any less important, that he just threw something in which, chew on it, who cares? No, it's tremendously important, and as you just mentioned, it's linked to it can really cause problems which then people maybe try to cure with aspirin and all kinds of things, and it's important. Anyway, Dr. Fatunde, thank you very much for giving us an overview of your practice. So basically, people come in, A, to look better, and B, it's not only about looks, it's about if your teeth are not straightened, there's a whole host of problems which could happen, and it needs to go together, and they need to be fixed. And you mentioned that adults also come, and I guess we're going to talk a little bit more about it, with some new ways of making the braces more comfortable and less visible and all that stuff. Many more adults who have been running around for years with teeth they didn't really like, they didn't want to shave them down, they didn't want to grind them down and put veneers and crowns on it, they now can straighten them out. So we're going to go more into those topics, but thank you for explaining us your practice. By the way, you didn't yet say how you became an orthodontist.
I always was intrigued with dentistry. So as a little girl, 8-year-old, I would go to the dentist for cleaning, and I was intrigued with the sound of the drill. And that sort of lured me into dental school. Yeah. That lured me into dental school. But once I got into dental school, going through rotations, I had another 8-year-old that did inspire me. And what she had was an orthodontic problem. And I was going through this rotation, and she was a very charming, pleasant girl. And so she was my patient. And by the time I finished treating Alice, I knew without a doubt I had to go into orthodontics.
Interesting. Wow. It's really nice to see, and that people, when they do something, they simply do it because of natural evolvement, natural development, natural realizations, enlightenments, cognitions, call it whatever you want to, kind of like, I want that. Not looking in the newspaper and says, well, what makes more money down the road? Where there's more? What does the survey say? And then go into that. But really like the typical firefighter, the kid sees the fire truck and all his life wants to be a firefighter and then just simply becomes one. It's wonderful. Thank you very much.
Thank you.